And welcome, everyone. It's great to see all of you. And I would like to introduce our first speaker, Mr. Larry Sloan. And Larry is the CEO of the American Industrial Hygiene Association. So we're really happy to have you here to speak with us today, Larry, and take it away.
All right. So Marianne asked me to give you an update on what's been happening at AIHA National with respect to this little thing called the COVID pandemic. And it has been a whirlwind year. I looking back over the last now 8 months has just been an incredible journey. And quite frankly, I've been talking about the COVID pandemic as kind of a black swan event. It has garnered us an incredible amount of attention as an association, and it has given the occupational health profession a presence on the national stage, if you will. We've gotten such presence with the mainstream media, ABC News, NPR, Wall Street Journal. We've had several members who have been interviewed for various stories over the last many months. And so that's all been absolutely amazing and transformational. But obviously against the backdrop of an absolutely horrific pandemic, and there's no signs of any abatement. Although they are saying that the caseload here in the United States, while the number of cases continues to climb, the severity of a majority of the cases is actually lessening. In other words, there are fewer people who are contracting the very serious version of the virus, but obviously it depends on a lot of circumstances and one's own health and age. So I'm going to spend the next 10 minutes just breezing through some slides that show what we've been doing over the last many months. And just a reminder for those that may not be familiar with who we are as an organization, and this comes from our strategic plan. Our mission is to empower those who apply scientific knowledge to protect all workers from occupational hazards. That is our purpose. And our vision is our aspiration is a world where all workers are healthy and safe. And so when you look at our current strategic plan, it's divided up into 5 different pillars. And each of these pillars basically reflects the various programs and services that we offer. So community, awareness, advancement of knowledge, integrity of practice, and advocacy. And I would say that this conversation with WHWB falls under community. WHWB is what I call an allied association to the AIHA. We have obviously many common members, and we are always looking for ways to explore synergies and collaboration between our 2 organizations, as well as many, many others. So everything that AIHA publishes in a video format is posted to something called AIHA Network TV. And it is available on YouTube, and you can see the link on this slide. And by the way, Marianne will be posting these slides to your websites, and so you don't have to take any notes if you don't wish. We have a variety of resources that are available on the AIHA Network TV, including resources pertaining to wildfires and other natural disasters. And we have on our website a disaster response resource center. So there are lots of resources that are available. There are booklets and guidance documents and other materials for those that are first responders in the face of natural disasters. So just a reminder that we do live on YouTube. Earlier this year, we launched what I'll call a brand pivot. It's not a renaming of the association. There was a little bit of confusion and a little bit of anxiety that we were no longer going to be legally named the American Industrial Hygiene Association. And that is not true. We will still remain the American Industrial Hygiene Association as a 501c6 organization in the United States. What we are doing, however, is when we explain who we are to outside audiences and to reflect the fact that our tent has broadened over the years, we decided to change I'll call it the About Us blurb. And so this slide delineates the new verbiage that we'll be using on the bottom of all of our press releases. And I boldface the significant change where it says scientists and professionals that are committed to preserving and ensuring occupational and environmental health and safety. So you'll see reference to OEHS throughout all of our communications. when we start our public outreach campaign, or I should say, when we continue our public outreach campaigns to students, business C-suite, EH&S executives, and other audiences, we are going to be branding ourselves simply as AIHA. We're not going to be spelling out our name in any of our outbound communications to these external audiences. And we're going to be using the OEHS acronym as we explain the value of the profession to these different audiences. Okay. So there are three principles to the AIJ, excuse me, brand evolution. Number one, there's generating much more public awareness about who it is that we are and what we do. And I will say that again, the COVID pandemic gave us a jump start in generating lots of awareness about the association and the great work that our members are doing. The second pillar is public education, developing new resources that will help to communicate what it is that we do, why we do it, where we have a role in this whole, not just this pandemic, but all the other normal occupational hazards that we face day in and day out. And then finally, geared at students and those that are undecided or perhaps wanting to take a mid-career shift. How do we recruit new professionals into the profession? How do we recruit students? And we start at the very early age with elementary school, junior high, and high school students. And we have various tools that we are deploying to introduce them to the concept of worker health and safety. And so these are the three pillars of how we are approaching the AIHA brand evolution. We're very pleased to announce we have two new websites. We call them public microsites. One of them is called www.workerhealthsafety.org. This site is now active, and it's really designed to educate the business C-suite folks. And we've decided to start our focus on three primary industry sectors: the chemical industry, which is where I came from as an engineer, the construction industry, and first responders. And so we're going to be posting new resources, new materials that are aimed at helping the non-occupational health or industrial hygienist understand the value that we provide society. So that's going to be housed on workerhealthsafety.org. The other one is oehscareers.org. OEHS Careers is designed for students of all ages. And this is where we're going to continue to post resources, starting again with the elementary school, middle school, high school, and even college students, to get them, first of all, aware that occupational health is a profession and a very viable and rewarding profession at that. And oh, by the way, if you're interested in helping to protect people at work, very altruistic, we've got a great message for you and you can make a career out of it. So as we continue to uncover tools that you folks are using in your local communities, if you're willing to share them with us, we will post PowerPoints and PDFs and other materials that you're using in your respective communities on this site. So we'll have a very comprehensive library of resources for students of all ages. We've already picked up some media through a variety of magazines as listed on this slide. We did an outreach campaign for oehscareers.org just about a week ago. We've already garnered quite a bit of interest, and we've garnered some advertisers on these websites that's going to help to offset the administrative costs. And we've been participating in a virtual science and engineering festival called SciFest. We have a virtual platform, and I believe that science festival is going on as we speak. So we're really starting to penetrate these virtual forums around the country that are attracting students that are interested in careers in STEM. And this is obviously an ongoing effort. It's going to take many, many years to continue to fill the pipeline, but we have to start somewhere, and we're very excited about the grassroots activities that we've already managed to accomplish and the plans that are ahead in the coming months. Now, switching to COVID, obviously we have a coronavirus outbreak resource center, which we started at the very end of February, and you can see the link at the bottom of this slide. There are a variety of resources, not limited to AIHA materials, but also links to NIOSH and CDC, OSHA, and others. And so if you're not familiar with the website, when you have some time, you can click through and browse around. And I'm very, very proud of this slide. From the beginning of the pandemic, our volunteer groups have snapped into action, and we have created some dozen guidance documents and infographics. Several of you on this phone call have been a party to these documents, and these have all been created in record time and we have been distributing them through our outreach campaign. And because of these documents, we have realized and garnered variety of interviews with the mainstream media. And so we have a variety of topics that are featured on this list. Again, when you get the copy of these slides, you can click through to any of these links to the documents themselves. They're all available for free download. And I'm very pleased to announce that all of these are being translated into Spanish. So eventually we're going to have a Spanish language page on the AIHA website where we will be posting everything that we offer that's available in Spanish. And we're actually also looking at exploring some limited translation into Portuguese. So there's been an incredible amount of sweat equity and effort that's gone into developing these documents and beginning the translation into Spanish primarily, with a foray into Portuguese. Because when you look at our international priorities, we have targeted regions around the world, and many of those regions are down in Central America and Latin America as a whole. So Colombia, Brazil, Mexico, Guatemala. We've got relationships throughout the Americas, and we want to make sure we provide as much COVID-specific information in their native languages as we are feasible. We've done some outreach. This is just a sampling of some of the activities that were accomplished earlier this year. The third bullet is very important. We were able to become classified as essential workers by the US federal government under the US Department of Homeland Security. So if you are an occupational health or safety professional, you are deemed to be essential under the pandemic. And the last bullet is something that we are now working on, and that is to reinforce the importance of bioaerosols and the transmission of any virus, including COVID. And we are in the process of garnering support from a variety of sister organizations, not just the traditional Oehs organizations, but also looking at epidemiology and infectious disease associations that are part of the broader health network. And our plan here is to create a fact-based short document, if you will, undersigned by hopefully 6 to 12 different associations, where we band together and we basically go on alert by saying, despite what you've seen from the federal agencies, the NIOSH putting things up, taking things down, putting things back up, we recognize collectively as a body of nonprofit scientific societies that bioaerosols and particles of all sizes play a role in the transmission of COVID and other infectious diseases. So that's something that is in the works. So a lot of great activity has been percolating behind the scenes. Back to Work Safely was a labor of love. It began in the end of April, and it is again a series of documents that are designed really for the smaller business owner who may lack the resources. And basically, it's a way to help provide guidance to help them safely reopen their operations during the pandemic. How the whole program got started was back in the spring when we didn't see much guidance from the federal agencies. We knew that the small business owners in particular needed some assistance. Starts were beginning to reopen their economies at the end of April, early May, and we realized that there was an urgent need out there, and we thought that we, as the stewards for worker health and safety, needed to play some sort of a role. But we didn't really know exactly what role we should be playing. Well, one night, former AIHA president Alan Flieger, who many of you know, was watching the news, and he learned that President Trump had started up a task force called Reopening the US Economy. And he learned that Mark Cuban, who is well known by the TV show Shark Tank, he was appointed to this particular task force. So apparently, Mr. Cuban is from Pittsburgh, and that's Alan Flieger's hometown. So Alan, in his stroke of genius, figured out a way to get in touch with Mark Cuban. He got his email address, and I don't know to this day how he found his email address, but he has a Gmail account. And he wrote Mark Cuban that night, and Mark Cuban immediately responded. And they went back and forth a few times just to make sure that it truly was Mark Cuban. And when they confirmed that it was, and they exchanged some stories about Pittsburgh, Mark Cuban says to Alan, if you guys are all about worker health and safety, you need to take a leadership role. You need to be the ones to develop these documents and figure out a way to help small businesses across this country reopen safely. So Alan got very excited, obviously, and said, the next day he calls me up and he goes, Larry, he says, we got to get Kathy Murphy and Lindsay Cook on the line. They're our president-elect at the time. We've got to form a task force. We've got to snap into action. We've got to take a lead. This is a once in a lifetime opportunity to really lead the nation and develop some common sense guidance. And that's exactly what happened. Lindsay and Kathy were on board. We formed a task force of about 15 members. It's grown over the last many months, and we started out with one guide for restaurants. One of the things that we did with these particular guidance documents was to make sure that all of them had the same framework, the same structure. So they're all structured from the standpoint of very common sense language. They're not written in highly technical terms. They're designed for the end user, for the general public. And they're organized around 3 different lenses. What do I need to be doing as an employer? What should I be doing as an employee? And if I am a member of the general public, a guest or a customer, and I'm visiting an establishment, what sort of things do I need to be mindful of? And that's the way every single one of these documents is structured, all 26 of them. They address topics like disinfection and cleaning, PPE, social distancing, how do you handle restrooms, training for your workers, things of that nature. And at the end of each one of these documents is a list of resources from allied organizations. So we'll have links to resources from government agencies and also from the downstream associations that represent these particular industry sectors. So for example, when we started drafting the one for restaurants, we reached out to the National Restaurant Association. For those of you that are not familiar with the nonprofit sector here in the United States and up in Canada, I'm sure, there is an association for every single industry sector and every single profession that you can think of. And so for every industry sector that we wrote about, restaurants, bars, gyms, hair and nail salons, the list goes on, there is at least one association that represents that industry sector. So we would reach out to that downstream industry sector and let them know who we are as an association, what we're doing with the Back to Work Safely guidance document, and oh, by the way, would you like to work with us? So a lot of these guidance documents incorporated information from these downstream associations that represent these different industry sectors. Many of the guides are being translated into Spanish as we speak. I believe about 8 or 9 of them have been translated. And our plan is over the next 4 weeks to translate all of them. So all of those non-Back to Work Safely documents that I showed on the last slide and all of these documents are all going to be translated into Spanish by the end of the year. Now, going back to this slide, the updates are monitored throughout all the 26 documents. We've been using RHP, which is a consulting firm based here in the United States, to make sure that the guidance is harmonized across all 26 documents because things have changed over the months. We've gotten information that's been a little bit different than we originally put into the documents. And so we want to make sure these are living documents. So every time we update a document, we update the revision number and the date on the cover. And we've also created some very eye-catching posters, and you can see 2 snapshots on the right side of this screen. And you can download these posters if you wish, these graphic designs, and you can print out posters or even make signs for your own place of employment. We've also had volunteers from the task force do webinars, and the webinars have been delivered across the country, literally from coast to coast. And I'm very proud of the fact that we've gotten some extra life out of these Back to Work Safely documents by reinforcing the principles through these webinars. And these webinars are typically done with third parties. So for example, for hair and nail salons, there were 2 or 3 webinars that we participated in. One was hosted by NIOSH CDC, and another one was actually hosted with the Beauty Supply Association. There's a lot of need for common sense guidance, and that's what these guidance documents are designed to fulfill. So again, here's a list of all of the Back to Work Safely documents, and you can see we steered away from large industries. So obviously, we were not going to do one for the airline industry because the airline industry is dominated by very large companies, and they can do their own guidance. These are designed for industry sectors where there are a lot of small business entities. And this slide shows a snapshot of the very many allied associations that we've been working with over the last many months. And this is not a complete list. I could go on for the next hour explaining our relationship with each and every one of these organizations, but suffice to say, these organizations have been partners with us either in Back to Work Safely, or we may have actually formed a small team of subject matter experts and work directly with an association on a technical issue. And as an example, the American Dental Association, which you can see right here in the middle of the slide, after they collaborated with us on the dental clinic's Back to Work Safely document, they had a question for us about ventilation. and how to handle bioaerosols in a dental office. And so we got 5 or 6 of our members together, and we formed a little SME, a subject matter expert team, to work with the experts at the ADA to address their questions one by one. And so through these relationships and the fostering of contacts at these different organizations, we continue to expand the presence of AIHA and awareness of the occupational health profession. And this is a labor of love for myself. I feel this is a very important part of my role as an ambassador for the association. And I want to thank those of you on this call, and you know who you are, for introducing AIHA staff to many of these associations and organizations out there. There's an incredible amount of effort and collaboration that's going on behind the scenes. Very, very important work. And finally, I just want to conclude with the fact that if you're interested in becoming a member of the AIHA, there's 2 ways that you can get involved. You could become a part of what we're calling our virtual section. So for those that are in the international community outside the USA and Canada, you can join the virtual section for only $10 if you come from an emerging or developing economy. You do not have to join AIHA as an official national member. You can just join the virtual section. Your benefits are a little bit reduced, but you still get access to a wide variety of services as listed on this slide, including the Digital Synergist, which includes the monthly magazine and the weekly e-newsletter. You get a slate of complimentary webinars. You get access to our online community called Catalyst, and you get ample opportunities to network, all for $10 a year. So that's one option if you want to become a member of the virtual section only. And at the bottom of the slide, you can see a link to the website. You can sign up online. Or if you want to become a full-fledged international member, we call it the International E-member, that is a little more money. And that gives you access to all of our programs and services. Features are indicated on this slide. The link is at the bottom of this slide if you want to join. And we always have a year-end promo, 50% off if you want to join between now and the end of the year. And I'm sure this promo will be running again in 2021. We're really trying to encourage more folks from around the world to become an international member, because even though we're US based, we are trying to expand our presence around the globe and continue to partner with our sister organizations where they exist. And with that, Mary Ann, I'm going to conclude and open it up for any questions.